Hello, everybody, and thank you so much for coming to the, Hello, everybody, and thank you so much to coming to the conference today. We want to talk today about patients with metastatic disease and the unique challenges they face living with a life-limiting illness. We have no disclosures. Janet?
Thank you. We want to talk today about patients living with metastatic disease and the unique challenges they face. This has become especially relevant during a time of the global pandemic when so many limitations have been placed on our daily lives. Currently, this population of patients living with metastatic cancer has not been well studied. And one of the reasons for this is that the emphasis has always been on survivors that have completed treatment and are disease-free. But as our therapies improve and more options have become available, people are living much longer with diseases that are incurable but often treatable. We know this population continues to grow and their needs are often different than patients that have undergone curative therapies. And our challenge, therefore, is to identify those needs and develop ways to support patients and families. Next. So how do you manage the tension between So how do you manage the tension between hope and reality in this day and age when new therapies are being developed and improved all the time? Often, if someone is well enough and lives long enough, they may have access to a new therapy that was not even approved when they were first diagnosed, such as the immunotherapies. So therefore, it makes it hard to plan and prepare for the future when there's so much evolving information that can change very rapidly. Again, we know this is a unique population of people that are living with cancer, a cancer that may never be cured, but will always be there and requires attention. Sometimes that attention can be all-consuming and takes over every aspect of one's life. The challenge for our patients is not to let the diagnosis and disease take over and beat them, but allow for joy and meaning as one continues to live their life. Next. So this population of people can also be called on-treatment survivors versus the previous definition of survivors that have moved beyond treatment and are cancer-free. We also know that while balancing living with a life-limiting disease, that we also have to face the reality of death, which we know will occur at some point. It's important to be able to face this and plan for it so it's less threatening and understand how to have some control over the way our lives end. It's also about maintaining and redefining hope. The hope of a cure or a long survival may not be realistic at some point, but there is hope for doing things that provide meaning and joy, identifying and completing goals, and to regain control over the physical self by managing symptoms and optimizing quality of life. Wherever you are in the disease continuum, there's always hope. You just have to keep redefining what you're hoping for and set reasonable and realistic goals that you can accomplish. So this slide shows that these are just a few articles that describe the need to address this new and unique population of cancer survivors. The New England Journal article, A Time to Study Metastatic Cancer Survivorship, highlights the needs and challenges of patients living with cancer. The number of all cancer survivors is expected to reach 26 million in the US by 2040. And this is also impacted by the fact that this population is aging. Current guidelines and recommendations do an excellent job for those patients who have completed therapy and are deemed in remission, but don't speak to those that continue to live with incurable metastatic disease. We know that a diagnosis of incurable cancer can have devastating and life-changing effects on patients and families, and we will speak to this specifically in a while. The challenges are how to help to live fully and optimize their time and also balance all the normal demands of daily life. Most patients are aware of new and emerging treatments, but the reality is that even some of the most promising treatments only work in a small population of patients and can often have devastating side effects, yet do offer the promise of hope, so are hard to pass up. Next. So again, some of the topics that we want to touch upon today is the uncertainty in illness and how one deals with that, the physical issues that come along with living with a metastatic cancer, the emotional issues, financial concerns, which we know are all present for everyone, things like sexuality, dealing with coexisting conditions and healthcare screening, long-term caregiving, and care coordination. Next. So despite all the advances in medicine, uncertainty still exists. As diagnostics, treatments, and specializations advance, so does the complexity of navigating decisions and the system itself. Prognostic uncertainty is especially difficult to live with, as many patients want to know, how much time do I have, but yet fear the answer they may get. For some, knowing is helpful, and others it may not be. Uncertainty can also be perceived and dealt with differently by the patient and the clinician. This inconsistency can also contribute to confusion and lack of information that patients need in order to make decisions about how to spend their time. Prognostication in the last 6 months of life can also be difficult, as a proportion of deaths are sudden and unexpected. Some patients hold on to uncertainty as a protective mechanism to protect themselves from the unpleasant information, and this process does require ongoing and accurate information that is tailored to the patient's needs, depending on how much they can and want to hear. Importantly, though, the patient and family needs to share in the decision-making and demand information that is consistent with the patient's goals and values, so that they can make choices along the way that optimizes their time and quality of life. Patients can also experience conflict in that they want to stay alive but don't want to live with the burdens of treatment with chronic cancer. And ongoing discussions about the benefits and burdens of various decisions and their effects on the patient needs to be a part of their comprehensive care. Burdens are not just side effects of treatments, but all the things that are required to maintain care, such as travel, time spent in the hospital, diagnostic tests, financial implications, and the time spent not doing what the patient enjoys. Next. So some of the physical issues that we know come along with living with a chronic disease, are vast and complicated. As one lives with metastatic disease, toxicities can become cumulative. So there's never a time during the new normal without side effects. Additionally, patients are aging with illness, so have to cope with managing other comorbidities and complications from treatment. Physical changes can affect all aspects of daily living and impair one's ability to participate in normal activities. Next. Kathy?
Sure. Some of the emotional issues that come up in this stage of illness is working to stay positive even when the setting of disease progression. So when individuals hear that their disease has progressed, they are often put into this place of feeling fearful and concerned. And it's important to talk about how does positivity help in that piece. Emotional exhaustion, the ups and downs of cancer can cause anxiety around test results. One of the things that a lot of the patients will talk about is really scanxiety. And what that scanxiety promotes is really this sense of anxiety around the time when we're having scans and how scans can affect our overall well-being. And it's helpful to talk to someone, particularly when we're talking about stress management and other ways to manage that anxiety that's around that particular occasion and event. And frequently it's about some healthy distractions that can be really beneficial as well. Staying optimistic for families and loved ones is one of the emotional issues that a lot of people deal with, but sometimes that's a difficult choice. And for some people that can feel like an emotional and a psychological burden. And so it's often sometimes okay to talk to people about how it is challenging at times to stay optimistic, and honest and true communication could really be the best result. This also, unfortunately, can stress relationships. Relationships have a delicate balance a lot of times. And unfortunately, when we add illness, particularly if it's for people like our parents or distant loved ones instead of our husband or our wife, we can feel like we're, not equipped. And so it's important at that point to feel like you can reach out and get some supports around that. How do we want to spend our time if time is short? And that's an important conversation and a really important communication to have. Priorities related to quality of life are something that we might have talked about before. We didn't think we needed to emphasize them as much, but at this stage in our life, we do have to think about how to emphasize those needs. Next. Janet?
So one of the things that plays into the distress and the difficulty sometimes in navigating our health under these conditions is that the longer we live with these cancers, that things like coexisting conditions and then questions about how do we screen for other things that could be going wrong with us come up. And again, no good guidelines for this in this population. Patients live longer with cancer and have more options for treatment. The risk of developing other health issues increases. And there's no guidelines when it comes to regular health screening when you're undergoing cancer care. And this adds to more uncertainty and distress and as to how to stay healthy when getting treatment for cancer and what the priorities and risks are. And this just comes down to really good communication between a primary care provider, which should always be included in someone's care, and the oncologist or hematologist. And they can usually facilitate these questions as they come up, and they should be tailored to individual needs and situations. Next.
So what are some of the psychological concerns? And I think it's important to talk about distress. You know, distress was identified in cancer primarily because we didn't want to emphasize the idea that people who have cancer automatically are going through feelings of depression and anxiety. Sometimes it's really a different level of that. It's really an idea of distress. And distress is described as the emotional, social, spiritual, and physical pain of suffering that may cause a person to feel sad, afraid, depressed, anxious, and lonely. People in distress may also feel that they are not able to manage or cope with changes caused by normal life activities or by having a disease such as cancer. Cancer patients may have trouble coping with their diagnosis, physical symptoms, or treatment. So when an individual is experiencing distress, it's helpful to reach out and to talk to someone else, someone in the clinic, or a nurse, or sometimes even a psychologist. One of the another psychological concerns is that people often experience feelings of denial. And in some cases, the denial can be a coping strategy to delay some concerns regarding issues such as end of life. However, if it extends to isolation or avoidance of feelings altogether, that can impact treatment and also connections with our loved ones. So that's an important piece to think about. So then we also do have to talk about the issue related to depression. Depression, the hallmarks in depression are this feeling of helpless or hopeless. When someone is diagnosed with advanced cancers, it's assumed that they will feel depressed. However, depression is often undiagnosed and untreated. The consequences of this can be a desire for death or isolation at the end of their life. So, what can we do about feelings of helplessness? Well, we can learn more about our diagnosis. We can seek useful supports and treatments. Participate in some lifestyle changes that can promote our physical and emotional well-being. For feelings of hopelessness, we can understand that even with a life-limiting diagnosis, we can fully participate in our daily life through healthy communication with our loved ones and other cancer patients. Understanding side effects of treatment and ways to alleviate them. Communicate about our feelings, opening up to loved ones or a professional. A quote that I find very interesting is, it says, human beings often find uncertainty more painful than things that they are certain about. So frequently we avoid the question of feeling, worried and scared and all of those kinds of things. And the more that we talk about that, the less we feel alone with the problem. And that's a very important part. Recognizing that by stating our feelings out loud, we lessen the burden of feeling alone with our problems. Another issue that comes up quite a lot in psychological concerns is issues of anxiety. So anxiety is the psychological and physical response to stress. We all talk about the fight or flight response. That's the idea of what anxiety looks like. These can be feelings of uneasiness due to the fear of the unknown. It can relate to a physical fear such as disease progression or psychological fears such as loss of self-esteem. As we know, there are different levels of stress. In mild stress, we become aware of our concerns. We may experience some physical tension. This can actually be a helpful response because we are often more open to information and learning about how we can respond to fear and look for ways to cope. So the mild sense of anxiety is actually sometimes beneficial, and it's important to know that not all stress is bad. Moderate, we can lose our sense of focus and awareness. In this state, our ability to hear new information and acknowledge ways to cope can be diminished. And then, of course, there's severe depression. We can experience incongruent and intrusive thoughts. Consequently, our capacity to learn or redirect our feelings can be lost. So, and another form of anxiety is panic. It's hard to concentrate or to organize our thoughts, unable to listen or to develop coping strategies. The issue of panic and increased anxiety needs to be alleviated before we can move forward, and any forward movement can occur, and will need to be addressed by stress management techniques or even some medical supports. Next. So one of the other psychological issues is issues related to quality of life. You know, the conversations around quality of life and improvement quality of life is often talked about in the cancer world, but what can it be? And sometimes it's a delicate balance between realistic hope, which can be defined as honesty and trust in the face of crisis. This includes symptom support, just like Janet was talking about in terms of some of the physical symptoms that we need support related to, physical issues such as pain or sleeplessness. Finding ways to address physical and psychological supports are very beneficial. The NCI describes quality of life as an overall enjoyment of life, an individual's sense of well-being, and ability to carry out activities of daily living. One of my patients wrote, "Courage and fear are partners. Fear either begets courage or panic. Panic produces paralysis. The trick is to leverage your fear, embrace your fear, and convert it into courage." This gentleman was quite a dynamic individual, but I can tell you that he lived fully right until his last and final days. And one of the most important aspects of his living fully, he communicated to me, was being able to talk to his loved ones and share his concerns, but also to share things that he enjoyed, talking about enjoyment in life and what was enjoyable at this moment. So what are some of our communication concerns? And this can relate to communication with family members as well as with our medical team. And so that's an important piece. It's important to be able to acknowledge emotions or fears. It is possible to form a partnership with your team so that you can guide the conversation, understand that you are in charge, and you do not have to, you're in charge, and therefore if you feel a topic may be emotionally triggering, you can let your providers know so that you don't have to feel that every visit with your provider has to be uniquely intense or emotionally intense. I remember having a conversation with a woman that was at a point in her treatment where treatment was no longer effective. But one of the things she didn't want to talk about was her end of life. And so when I would come in, she'd say to me something as simple as, "Kathy, we're not having a D conversation today." And D, of course, represented death in her life. And I think it was important for her to set that boundary, and we would talk about other things. Interpersonal and family relationships can be affected by chronic cancer. Therefore, it's helpful to address unresolved conflicts. Often it's important to have family members attend appointments, which include medical or counseling sessions. This can help to address feelings of distress, some unmet needs, obligations, or responsibilities. Often it's important to have family members included to understand information related to the cancer diagnosis, to assist in some decision makings, or to be more fully understand decisions you may be considering. Next. So some of the financial concerns in treatment and cancer treatment in general is always a very big topic and a very big issue. It's important to talk about, are there specific finances related to some of the new forms of therapy that might be going on? Long-term loss of wages and productivity can be a big issue, especially if someone is in the middle of their work life when metastatic disease is present. So it's important also that the good news about insurance issues, if employment is lost, is that hopefully we have some very talented, and in most hospitals we have very talented social workers that can really talk about insurance coverage and how to help people find insurance coverage for specific needs like that. The financial burden of travel or even hospitalizations, there's many times there's funds that are community supported that are related to helping financial financial support around travel expenses. I was talking to a gentleman yesterday who was going to be utilizing Angel Flights, and Angel Flights actually it's a volunteer group of pilots who will fly people to places like Boston for treatment. So those kinds of things can all be alleviated if we can just talk about it. The challenging thing in all of what we were just talking about is really to be able to recognize that all this communication with our medical team, with our family members, is essential in order for us to move forward in a positive way, and also to be able to take charge of what's going on in our life and in our care right now. Next. Janet?
Long-term caregiving. We know that having a chronic illness that requires a lot of medical intervention, and sometimes, again, complete changes in lifestyle with loss of jobs, being home, not being able to do things, it puts a lot of physical and emotional demands on our caregivers. And it's very difficult to find sort of relief for these people. And there are some support groups out there which we try to direct people to, but it's always difficult when there's so much on people's plates to ask them to do yet more things. So we know that this is really a big issue for a lot of our patients and families. This again puts more financial burdens. If someone is the caregiver and can't work, in addition to the patient not being able to work, then there can be a complete loss of income in a home. And again, additionally, if they have to bring in extra help, these all, put huge burdens on people and affects their ability to cope with all this. And also the patient always, we struggle with, they feel like a burden on their family and caregivers because of what is happening. And that adds more stress to them, added to the difficulty of having to endure treatment and the disease itself. And then, the roles change. Children can become caregivers for parents, spouses, obviously, and I've even had many, many situations where elderly parents will step in to take care of adult patients that are going through this. And it's all very, very difficult. And as Kathy mentioned, there are a lot of resources out there. We just, as providers, we need to understand what our patients' needs are, and that goes back to having good communication and telling us exactly where their needs are and what we can do to help them. And that's often hard because people don't like to ask for help, especially if they're used to being independent. It is very difficult for them to come and ask when help is needed. Next. So care coordination is part of what we do as providers. The medical system is complicated, as every patient knows. It's specialized and fragmented and very often difficult for the average patient to navigate. If you're fortunate enough to have a palliative care provider on your team, they can often help with a lot of these sort of issues. But if you don't have access to a palliative care person, then you can arm yourself with knowledge and information so that you can better navigate what's going on. Having conversations around benefits and burdens of choices of care options should be ongoing and aligned with the patient's values and goals. Every time an option is put in front of you, you should ask, what is that going to look like for me? And is that consistent with what I want and how I want to spend my life? Patients need to demand information, and providers need to equip patients with the information they need to make reasonable decisions. And that's just, it sounds really obvious, but it really is something that has to be advocated for. And this information should also include what a no treatment option looks like, and what this, again, and how this is going to impact patients and families so that they can make plans for care. The need and ability to assimilate information should also be assessed by the provider and discussed with the patient and family. Some patients need to know every relevant detail when others choose to only be told what they need to know to get through certain situations. And it's really important for providers that they ask permission to share information and help the patient understand what is necessary for them to know in order to move forward. Everyone has their preferences about how they receive information, and it's important for patients to let their treating team know what they prefer and when they prefer it, as Kathy mentioned. Additionally, at times, treatment schedules can be negotiated to accommodate preferences and life events. And this is something that patients always seem surprised about when I suggest this, in that they can't deviate from whatever they're told to do because they're so used to having us all tell them what to do. And of course, it's important that treatments be given appropriately to optimize outcome. But in the case of metastatic disease, where patients are facing indefinite and often lifelong treatment, it's really important for emotional well-being that they have some control over their time and spend it in a meaningful way. So that if an event or something is really important and they need to craft their treatment plan around that, then that is something that they should feel free and comfortable with speaking to their treating plan, their treating team about. Next. So another way that patients and families can take control is to actively participate in advanced care planning. And this is something that everyone, I think, shies away from and doesn't really want to address, because it does really speak to the fact that they are putting a plan in place that describes how their life will end. But it is something that we can control while we're living, and when we can think about what we really want and what's important to us. For instance, if the goal is to remain at home and allow a natural death surrounded by loved ones, then decisions should be made around treatment and interventions that are consistent with that goal. And that speaks to things like, if you want to be home and you want hospice services in place and you want your family there, then you're not going to make choices to have things like CPR or intubation or life extending measures that can only be delivered in a hospital. It would be inconsistent with a home death. So you have to think about how you want your life to end and where you want it to end. And having clear conversations with surrogate decision makers, so whoever you name in that advance directive, about what you want or don't want if life were ending, is really important and crucial to spending the last days to weeks of life in a way that's meaningful to you. So even though death cannot always be controlled, there are things that can be done to ensure patients die in a way in a setting that they desire. So we have a short TED Talk here. It's just a few minutes on end-of-life planning that basically I thought kind of said it all in about 5 minutes with regards to what we should be thinking about in order to prepare for this time.
What would be a good end of life? And I'm talking about the very end. I'm talking about dying. We all think a lot about how to live well. I'd like to talk about increasing our chances of dying well. I'm not a geriatrician. I design reading programs for preschoolers. What I know about this topic comes from a qualitative study with a sample size of 2. In the last few years, I helped 2 friends have the end of life they wanted. Jim and Shirley Modini spent their 68 years of marriage living off the grid on their 1,700-acre ranch in the mountains of Sonoma County. They kept just enough livestock to make ends meet, so that the majority of their ranch would remain a refuge for the bears and lions and so many other things that live there. This was their dream. I met Jim and Shirley in their 80s. They were both only children who chose not to have kids. As we became friends, I became their trustee and their medical advocate, but more importantly, I became the person who managed their end-of-life experiences. And we learned a few things about how to have a good end. In their final years, Jim and Shirley faced cancers, fractures, infections, neurological illness. It's true. At the end, our bodily functions and independence are declining to 0. What we found is that with a plan and the right people, quality of life can remain high. The beginning of the end is triggered by a mortality awareness event. And during this time, Jim and Shirley chose ACR Nature Preserves to take their ranch over when they were gone. This gave them the peace of mind to move forward. It might be a diagnosis, it might be your intuition, but one day you're going to say, this thing is going to get me. Jim and Shirley spent this time letting friends know that their end was near and that they were okay with that. Dying from cancer and dying from neurological illness are different. In both cases, last days are about quiet reassurance. Jim died first. He was conscious until the very end, but on his last day, he couldn't talk. Through his eyes, we knew when he needed to hear again, it is all set, Jim. We're going to take care of Shirley right here at the ranch, and ACR is going to take care of your wildlife forever. From this experience, I'm going to share 5 practices. I've put worksheets online, so if you like, you can plan your own end. It starts with a plan. Most people say, I'd like to die at home. 80% of Americans die in a hospital or a nursing home. Saying we'd like to die at home is not a plan. A lot of people say, if I get like that, just shoot me. This is not a plan either. This is illegal. A plan involves answering straightforward questions about the end you want. Where do you want to be when you're no longer independent? What do you want in terms of medical intervention? And who's going to make sure your plan is followed? You will need advocates. Having more than one increases your chance of getting the end you want. Don't assume the natural choice is your spouse or child. You want someone who has the time and proximity to do this job well, and you want someone who can work with people under the pressure of an ever-changing situation. Hospital readiness is critical. You are likely to be headed to the emergency room, and you want to get this right. Prepare a 1-page summary of your medical history, medications, and physician information. Put this in a really bright envelope with copies of your insurance cards, your power of attorney, and your do not resuscitate order. Have advocates keep a set in their car, tape a set to your refrigerator. When you show up in the ER with this packet, your admission is streamlined in a material way. You're going to need caregivers. You'll need to assess your personality and financial situation to determine whether an elder care community or staying at home is your best choice. In either case, do not settle. We went through a number of not quite right caregivers before we found the perfect team led by Marcia, who won't let you win at bingo just because you're dying. But we'll go out and take videos of your ranch for you when you can't get out there. And Caitlin, who won't let you skip your morning exercises but knows when you need to hear that your wife is in good hands. Finally, last words. What do you want to hear at the very end, and from whom would you like to hear it? In my experience, you'll want to hear that whatever you're worried about is going to be fine. When you believe it's okay to let go, you will. So, this is a topic that normally inspires fear and denial. What I've learned is if we put some time into planning our end of life, we have the best chance of maintaining our quality of life. Here are Jim and Shirley just after deciding who would take care of their ranch. Here's Jim just a few weeks before he died, celebrating a birthday he didn't expect to see. And here's Shirley, just a few days before she died, being read an article in that day's paper about the significance of the wildlife refuge at the Modini Ranch. Jim and Shirley had a good end of life, and by sharing their story with you, I hope to increase our chances of doing the same. Thank you.
Next. So I think that sums up another way that you can really control how your life ends. And I think that when people do put a plan in place, or at least outline some things that are really, really important to them, it does give them peace of mind, knowing that some of those issues are addressed by them and not leaving it up to others. So what can you do to have more control when you are facing a life-limiting illness? You can ask health professionals to clarify and explain things clearly if you are uncertain about the information. This is not uncomfortable for healthcare providers. They Sometimes we all lapse into medical lingo that is difficult for people, and it's always okay to ask to have things explained and put into simple or clear terms. You can ask about the benefits and burdens of different treatment options. What is this going to look like? What is this going to do for me? How is this going to affect my life? And again, burdens don't always it's not just about side effects, but the time spent in hospitals, tests, potential complications. And again, getting involved in things that prevents you from spending the time the way you want to. Don't be afraid to speak to how much information you want and don't want, and how much you want to participate in that decision making. This is a very individual thing. Some people want lots of control. Some people are fine to defer to their providing team, but it really helps as a provider to know where you stand on this. Don't be afraid of communicating what's important to you in your life and whether treatment options are consistent with your values and goals for this time. And we need to know if this is still working for you and what you're hoping for, so that we can continue to adjust your plan of care to give you what you want. The greater the patient involvement leads to greater patient satisfaction with care and less distress around all this uncertainty. Next. So one of the things we are developing right now in the Cancer Center is a shared care it's called Shared Care for Advanced Cancer. And it's basically a shared medical model. And we're working to develop this to support both men and women with metastatic cancer. We are going to develop a virtual group, like everything else right now, with the plan to meet every other month, at which time the facilitators of the group will meet with each patient. So it's a group visit, but each patient will have time to speak one-on-one with the providers. The goal is to share experiences amongst the participants to discuss successes, concerns, fears, expectations with others. We know that our patients are the experts on these things, and often their own experiences can really be beneficial to others that are going through the same thing or anticipating going through the same thing. From time to time, we'll present topics, most likely at the end of each session, that will be chosen by the group's participants. Some of these may include pain control strategies, nutrition, next. How to exercise safely with metastatic disease, integrative therapies that can be supportive and helpful, different treatment modalities, things like radiation, what is an immunotherapy and what does that really mean? Coping with grief, which we all experience, things like advanced care planning, caregiver issues, financial concerns and legal issues, and child life. These are just some of the topics that have come up from our patients. There's many, many more, of course. We hope to begin the group in January 2021. Initially, this will be a grant-funded pilot, so there will be no cost for participation. And anyone who would be interested in this can contact Christy Grover at that email address and just let her know, and she's going to develop a list for when this rolls out. She'll get in contact with these people. Next, these are just some resources to help if you're looking for some support groups or some connections. Next. This is just a quote that I like. William Osler suggested, "The practice of medicine is an art, not a trade, not a business, a calling in which your heart will be exercised equally with your head." And I think this speaks to the fact that this is not all about lists and numbers and lab values. It's about human beings and what they're experiencing, and we never want to forget that. And we always want to make sure that we individualize our patients' experiences to meet their needs. I want to thank you very much for joining. Kathy will be here to take questions live. Thank you.
Thank you very much.